is dedicated and committed to working with physicians and providing nothing but the highest quality medical care to our patients and their families. PAs are a critical component in the delivery of health care, not only at this hospital, but nationwide. You should be aware that PAs provide medical services in partnership with our supervising physicians. PAs do not practice independently and must provide care that is within the scope of practice of our supervising physicians. The physician is always ultimately responsible for anything a PA does and is not required to be physically present while a service is delivered. In hospitals, for example, to provide any service, PAs must demonstrate initial and ongoing competency, not only to the satisfaction of their supervising physicians, but to the hospital as well. Each PA must be individually credentialed by the hospital to perform any procedure, and there are numerous internal and external checks and balances to ensure patient safety, including the same performance and assessment and improvement processes as for physicians. Many procedures, like central lines and chest tube insertions, are performed on a regular basis by trained and experienced PAs. PAs would not be permitted to do so without the approval of their supervising physicians and institutions. PAs are educated at the graduate level with a rigorous curriculum that follows the medical model and often shares classes and clinical rotations with medical students. After graduation, PAs take a national certifying examination, and to maintain certification, must retake the exam every 6 years. In addition, PAs are required to obtain 100 hours of continuing medical education every 2 years. In New York, PAs are both registered and licensed. A PA can provide a broad range of medical services, caring for patients of all ages in nearly every area of medicine and surgery, from rural to city, from offices to hospitals, from pediatrics to geriatrics, from emergency rooms to surgery and intensive care units. Numerous studies have demonstrated the effectiveness and quality of care provided by PAs, including studies performed at hospitals here on Long Island. PAs are patient advocates, and many surveys have shown high levels of patient satisfaction with the care provided by physician assistants. The New York State Society of Physician Assistants and the over 8,000 PAs in our great state are very proud of the care we provide. We are highly trained professionals here for our patients and their families. We care about quality health care. We care about positive outcomes. We care about doing the right thing. We care about our positive role in the healthcare system, and we know that many, many people are living healthier, longer, and more satisfying lives because they were treated by a physician assistant. Thank you.
Yes, so we'd like to open up for questions now.
Sean Bergen from News 12. My question goes to Dr. Murphy. Doctor, I'm holding in my hand a PowerPoint presentation that was, I guess, administered to your staff here. This details 22 requirements for improvement from the Joint Commission. Is that number typical?
The final number is yet to be determined, my understanding. I'm not a Joint Commission expert, but they are presently reviewing the number of recommendations for improvement based on the evidence that we have provided them in the last several weeks. So the number is actually up in the air. I'm not qualified to tell you what's a typical number or not.
Just 22 seems a little high to me because our sources indicate that 3 or 4 is the average, and these look like pretty serious requirements for improvement. Medication reconciliation, medication labeling, and hand hygiene, just to name a few.
For me?
Yes, sir. If you could just move the mic over to him. Thank you.
Again, I'm not qualified to comment about the number of, I think it's RF requirements or requests for improvement. I do know something about our quality improvement statistics, and I do know that our hand washing statistics are very good.
It would seem that the Joint Commission is making so.
I think they're considering the evidence that we're presenting to them at this moment. But again, not a Joint Commission expert.
Dan, I think that's a preliminary survey result, and the final survey result is not yet out. And
So this figure could go up?
it could actually go down,
Yeah.
not up.
Oh, so it's not gonna go any higher than 22, you're saying that it's gonna go down?
I don't know the future, but as a physician here on staff, I know that we give excellent quality care and safe care to our patients. And that's a preliminary finding. And the hospitals put in their reply, and their recommendations have been followed. And we'll see what the final survey comes. Just wait for the time.
The State Department of Health is investigating 3 deaths right now. They've already concluded that one woman died from surgery that she never really needed. This does not really mesh with what you're telling us.
As we said at the beginning, we're not here to discuss any specific cases. It's not fair to the patients and to their families to discuss specific cases at this conference in a public forum.
Certainly you can discuss
But-
the
but-
Department of Health's investigation, though.
We're not here to comment on that. Basically, as far as the recommendations for improvement, 19 of those clarifications had been sent to the, that's a preliminary report. 19 of those have been contested, and it's very likely they will be eliminated in the near future.
And I could take a point about the Department of Health. If you were to survey in this state how many hospitals are under investigation or being reviewed statewide at this moment, I think most Department of Health officials would say most, perhaps all hospitals in the state. The word investigation reflects a relationship of sometimes self-reporting. We have to come back to this peer review, the way quality improvement works at hospitals, and it's a two-way street, and Department of Health is part of that. So they are here as on a steady basis. They are at every hospital on a steady basis. What's terribly egregious about this particular discussion is that we're talking about some human beings here, and we shouldn't be doing this right here in this forum. And we can personally attest and vouch for the quality of Mercy Medical Center, day in and day out.
Dr. Colantonio singled out, he singled out one physician assistant, in particular, Joseph Sharkey, which I think everybody's well aware of. It's not like I'm stating anything that
You know,
anybody doesn't know.
This is not hard. This is not easy for us. We're not used to sitting here before you guys. It's going to sound like a quote. I know Joe Sharkey, and I know how good he is. He's excellent. His statistics, I'm not privy to because of confidentiality and things, are excellent. His skills at the bedside are profoundly excellent. We actually remark among ourselves how good he is.
I think most people in this room, if they were sick in the ICU, would be happy to see Joe Sharkey at the bedside.
Okay, so here. So given that, there's got to be some motivation for someone slandering someone so intently.
I don't think we have enough time in this forum to discuss this. And I don't think this is the appropriate time to discuss it, but
What do you attribute this?
I would like to add something. Swana Devarajan, Director of Pediatrics Neonatology. I sit in various quality improvement committees. Joe Sharkey's performance and his file was looked at from a quality standpoint. His rate of complications for central line insertions, CVP insertions, chest tubes were looked at and compared to the national benchmark, and it's way below the national benchmark, way below for you.
Despite 3 deaths being attributed,
This is a
They were not.
baseless accusation. It's
Yes.
false.
but was he
It didn't
present
have to
during?
do with him being a physician's assistant?
No.
No, it did not.
This is,
absolutely not.
we cannot say
Absolutely
this forcefully enough. These are misrepresentations of the facts and an unfair, slanderous accusation against Mr. Sharkey.
I can say,
Investigated by the Department of Health, then? Is that untrue?
Well, let me teach you about the Department of Health again. Whether we report it, or if someone complains that there was a fly in their soup in the cafeteria, or when there's concerns, the quality process warrants an investigation, a strong word. And sure, we're going to look at it. We're going to make sure that everything was done appropriately. We have, actually. I'm not privy.
Was that investigation brought on by Colantonio?
It could be brought on by any United States citizen or patient or loved one or one of you. It could be, that's a fair, it's the way it should be.
Most investigations of the Department of Health start by our reporting to the Department of Health of an event that happened.
So is it coincidental that he was the physician assistant linked to these 3 deaths? Do you contribute that? Is that a coincidence?
I can say, without speaking of specifics of the case, that those allegations are completely false.
So he was not.
Joe Sharkey is not responsible in any way
Can
for
I-
any patient's death.
One more point for educational purposes. He is the intensive care unit physician assistant. I've got, people don't always survive. They have terrible illnesses, terrible injuries. So the fact that Joe Sharkey is in the intensive care unit and people die are unrelated. He's excellent at what he does.
Is he still working? He's actively working?
I hope so.
I'd like to comment
Yes,
a
he
little
is.
bit.
Yes, he is.
I think another thing to keep in mind is the overall process. I don't think anybody in this room or any other hospital conference room is going to say medical mistakes do not happen. They do. We have all sorts of processes in place at Mercy Medical Center that is as good, if not better, than any other institution in this community. We try to identify problems. We discuss them at M&M conferences for educational purposes, for purposes to prevent these events from happening in the future. This process has been corrupted. Could you imagine a physician who is now willing to discuss a complicated case with the knowledge that that information may be leaked to the press and his name and reputation slandered forever? So in effect, it compromises patient care in the end.
In our conversations with the administrators and officials over at Winthrop University Hospital, they say Dr. Colantonio is a physician in good standing with them. What could possibly be motivating him in this case?
I really can't comment for what the administration said at Winthrop or here, but as a physician, I've looked at some of the websites, ABC's website, and I've seen reports that he doesn't really have full privileges at Winthrop, that his privileges are limited. Can't take emergency room, and he operates with an assistant. That's just what was reported on some of the websites. I don't know it personally.
But you don't know what could be motivating him in this case?
It would be conjecture. We have theories, but it's not worthy of a public forum or discussion. He has rights too. We're not here to attack him. We're here to forcefully refute his misrepresentations and falsehoods.
But one of you had mentioned that he had been more severely reprimanded than any other physician in recent memory. That one of the-
Three such cases in 10 years.
In 10 years. So is it your contention that he is just lashing back in response to that retaliation?
If I could
That's-
clarify
that-
that, our medical staff bylaws, which are produced by our medical staff and revised through the years, protect physicians against false accusations and gives every physician the right to defend himself against any accusation. And I want to make it clear the distinction between administration and medical staff. These proceedings were prompted by complaints from his colleagues, from the medical staff, from nursing, from physician assistants. It was not prompted through administration. It was presented to the appropriate chain of command, if you will, and then discussed in a credentials committee, whose job was to hear his case and his arguments. Upon unanimous vote by this credentials committee, it was then presented to the executive committee of the medical staff. And the decision was to terminate. So it is a thorough and fair process that is not brought on by administration, but by his fellow members of the medical staff.
Dr. Colantonio maintains that his complaints predate this disciplinary action and that this action on the part of his colleagues were merely retribution for his having been a whistleblower.
That would be a misrepresentation of the facts.
That's absolutely not true.
Could you explain that further?
And there's no whistle to blow here. We have quality care here. We have safe care here. Our patients are happy to come here time